Greetings from Nashville, Tennessee. I'm Carol Swain, and this is Be the People. Each week we examine the social, cultural, and political issues that affect all our lives. Many Tennesseans are familiar with our guest today because of his reputation as a pioneer in LASIK eye surgery. Dr. Ning Wang, what a pleasure to have you on the show.
Thank you for the invitation, Carol.
I'd like for you to tell our viewers about the intersection between faith and science as you see it.
You know, Carol, this is such an important topic today with the rapid development of science and technology. And science has been able to explain more and more things in our lives and being able to change our lives in many ways never imagined possible before. At the same time, at the core of our existence, we have a faith and beliefs. And
well, some people don't, but you do, and
yes,
I do.
And I think it's important to have one. And so it is an important question. We have to confront it and have to resolve in our own hearts a solution, how we're going to go about it, the intersection and sometimes the conflict between science and faith.
And I know you struggled with your awareness that there could be medical breakthroughs using stem cells, and then your belief in the sanctity of human life. How did you resolve your struggle?
Yeah, it's been a very difficult journey for many years, and I still have to say I'm continuing learning and still trying to continue find the answer. In some cases, we have been able to. Basically, for example, stem cell, fetal tissue wound healing research. And as a Christian, we say, you know, Bible said human life, a baby, embryo is a fetus, is a human life.
It's always in the Bible, it says exactly. A pregnant person is with child. It doesn't make that distinctions that we make.
Exactly. At the same time, as a doctor, as an eye doctor, I face with the situation every day when you face with a patient with chemical injury trauma. Mm-hmm. We know that many of those injuries, we know, or genetic eye disease can be adequately treated or can be even possibly treated with research with stem cell and fetal wound healing research. And sometimes if we put ourselves in the shoes of a patient and we realize that, you know, how we're going to say no to research to improve the quality of lives. So this conflict between science and faith does exist in many branches of medicine, including ophthalmology.
But you were able to resolve it in one particular case, and how did you resolve it?
Yeah, we started corneal wound healing research many years ago. The patient with trauma injury, and initially they could see, but then they developed scar, which resulted in blindness. And I was a medical student at Harvard in Boston, and I was working as a medical student taking care of these patients, and I asked my professor, how can we reduce the scarring? And professors say, well, that's a tough question. You know, however, we do know a child can heal much better. Here's the question, how can you study how the baby can heal so well without, and benefit adult patients without touching any part of the baby? And we struggle with it, and obviously fetal wound healing research is a very promising area, but how can you conduct fetal wound healing research without touching any part of the baby? However, we persisted, and you know, Bible says, James 1:4 said that, you know, perseverance will make one complete. So we persevered, and we just continue work at the problem, and eventually we found that the amniotic membrane surrounds each unborn child.
And that's the sac that encases the baby.
Yes, and we postulated perhaps the sac that surrounds the baby may confer the scarless, youthful healing property of the baby. So if that's indeed the case, then possibility might exist that we can actually, without touching the baby, just use the sac and perhaps transplant onto adult eye to recreate a fetus-like environment.
And so you created a contact lens that was made out of the
amniotic membrane. Yes.
And it has brought sight to thousands of people.
Yes. By recreating the fetus-like environment, you basically make the adult eye, the injured eye, thinking, oops, we're not born yet. So they can regenerate again as they used to do before the person is born. So by using the amniotic membrane, in this case amniotic membrane contact lens, that we can recreate this fetus-like environment to help adult eye heal. And in this case, basically conducting fetal wound healing research without touching any part of the baby.
You know, I've read your Christian testimony, and part of that testimony is that you prayed and God gave you the insight that you could help people that were suffering, and at the same time, you know, you didn't have to destroy a human life. And so that contact lens is just amazing what occurred there.
Yeah, and we tell mothers who have babies that we wait until the baby's born, and after baby's born, you know, the placenta with the amniotic membrane always gets discarded. So instead of that, we harvest those and make into contact lens.
Okay, well, Dr. Wang, we're going to continue our discussion in just